Welcome, everybody. I am so excited to be here today with this session of the virtual Indegene Digital Summit. I'm here today with two esteemed colleagues, and I'm very excited about this topic. The title of the session is Honing Your Tetris Skills in Search of Effective Resourcing Strategies for Medical Writing Groups. And the reason I think this topic is so interesting is because resourcing medical writers is a challenge that we're all facing and managing every day of our lives across the industry. But so few people take the time to actually stop and talk about it. How do we get this right? And that's what we're going to do today. So let me just introduce myself. I'm Julia Forjanic Klapproth. I'm a senior partner at Trilogy Writing and Consulting. And I've been a medical writer for over 28 years. Before that, I started out as a professional doing research. I was in developmental neurobiology. But my favorite part of research has always been writing and talking about the science. And so I was lucky enough to become a medical writer at a big pharmaceutical company. I worked there for several years before setting up Trilogy 23 years ago. And I got very actively involved in the medical writing community. I've been president of the European Medical Writers Association twice. I'm currently an active member of the American Medical Writers Association Executives Council. And I'm really quite passionate about always trying to raise the bar on the value of strategic medical writing in the industry. So that's me. I'll pass over to Kim to let her introduce herself.
Hi, everybody. My name's Kim Jochman. I've been in the medical writing industry for about 18 years, which I thought was a long time until I saw how long Julia and Matt have been doing this. I have about a 50-50 split. I've spent about half of my 18 years at a CRO, which is where I started my career as kind of a juvenile and early teen or tween medical writer, and then my adolescence and adult medical writing years have been spent in big pharma. I'm currently at Merck, and I'm really deeply committed to talent development. In my current role at Merck, I lead several development programs, from an internship program for students to spend their summer, to an early talent development program where we bring in entry-level writers, and then we also have different kind of what we call cross-development programs for people of varying levels in our group. So I get to oversee them all and really help people develop in their careers. So I'm also very involved in the medical writing industry, especially through the American Medical Writers Association, or AMWA. I'm involved in the AMWA at the national level as an educator, and I'm also involved in the local level. I'm a proud member of the Carolinas chapter, and I like to, just be involved and network and contribute to the industry in that way. So I guess I'll hand over to Matt to introduce himself.
Thank you, Kim. Hi, I'm Matt Robillard, and I'm a senior director at AbbVie on the campus in the Chicagoland area. I've been in pharma for 33 years. I started as a technical writer many, many years ago, and actually worked in device fields. I wrote many operating manuals for pumps. Abbott at that time was known for their array of pumps, and Abbott Pain Manager may be familiar to some of you. I wrote the manual for that. Switched over to devices, analytical devices. Abbott Diagnostics was huge, and I learned how to write software operating manuals. And in '96, I got an opportunity to move over to a group that had one product that they were investigating. Abbott had a hospital products division, kind of went rogue and started doing their own thing with proprietary drugs. They had Calcigex, which was a very famous ESRD drug. End-stage renal disease drug, ESRD. And they also had sevoflurane, and that was about it. The PPD division had all of the compounds, and they were kind of irritated that the hospital products division was going rogue. And they brought me in to help with an NDA, and I knew nothing about medical writing at the time. This was '96, about actual medical writing, and I had this fearless attitude. I said, "What am I writing?" They said, "A clinical study report." I said, "Do you have a sample?" And I got a sample of one, and one of my employees found it for me in the system and put it on my desk, and it was 95022 for Zemplar, the Calcigex replacement. and it was 35 pages long. That was my first CSR. So imagine that far back in time and writing a 35-page CSR. I've jumped around a lit, not as much as a lot of people. I've worked as an independent. A lot of medical writers have had their own company, been their own resource. I've worked at 4 different CROs, and I went back into pharma in 2006 with Takeda Pharmaceuticals, known for Actos, and then 2017 I was brought to AbbVie. One of the things that I have specialized in over my career is building medical writing departments. I'm currently in the 4th iteration of helping build out a medical writing group. At Takeda, while I was at Takeda, I had the good fortune to get my MBA in leadership at Lake Forest Grad School. And right now, I'm become kind of a AI guru in medical writing. I'm working with a large-scale project to automate our NDA ANA reports and use AI to help us with that. And it's always changing. I love leading my teams, and I'm very glad to be here.
Thank you, Matt. Thank you, Kim. I'm so glad to be having this conversation with both of you. So I think just to get the ball rolling and set the stage for the conversation, I think it'd be helpful to describe first, before we get into the challenges, what we think efficient resourcing would actually look like. What are the things we're trying to get to? What are our goals? And then ultimately, obviously, the goal of every resourcing group is to get the right writers onto the projects, right? But what is the right writer? I think that's where the challenge already starts. The right writer is not only somebody who has the ability to write the document, has proven their ability to write their document, but has also experience, ideally, in maybe the therapeutic area, working with that team, and understanding of the compound. I want to say I don't think that a writer has to have all of those things to be able to excel as a medical writer on a project, but obviously the more experience they have with any of those touch points, the more easily they're going to come in and pick up and run with the project. And then this might sound obvious, but it's not trivial. They have to have sufficient capacity when the project is running. So the perfect assignment is about what we always say, getting writers into their sweet spot. You need to work with their personal strengths. Different people have different characters. Different people like different types of things. If you have a writer who hates protocols, don't assign them to a protocol. Matt, exactly. Because they're never going to be as engaged as somebody who loves protocols, right? So you need to be thinking about, and that's Kim, you need to be thinking about, what does this person love? What is their character like? And there's different chemistries between people, right? You can take somebody who's an ace on one project, you put them into another team, and for whatever reason, the chemistry isn't right. And it never flows. So you have to be thinking about all these things, and you have to make sure that your writers are not overloaded, because obviously, if a writer is juggling too many balls, they're going to drop something. And it's not a question of whether they will. They will. You can only do so many things in a day. You can only do so many things in parallel. And if you want to ensure their ability, their attention to detail, and their ability to deliver a high quality document, they have to have the time available to think about it and work on it without too many other things going on in parallel. So I think that sounds really obvious, but the question is, why is that so darn hard? Why do we struggle with that? And Kim, I think I will throw this over to you to pick up from there.
Yeah, sure. Thanks, Julia.
So we can go to the next slide. Sorry, I thought I'd throw that in there.
Okay, yeah, next slide, right. So I mentioned I'm passionate about talent development. And so maybe it's not surprising that one of the biggest challenges I find is figuring out how to best balance developmental needs of medical writers with the actual project work that's available. And this is really critical. Getting that balance right is critical for talent retention and job satisfaction. Like you said, Julia, we want to get people in their sweet spots. How do we know what that is?
Yeah.
And if there's a mismatch, no matter what level a writer is at, if they're getting something that is repeatedly getting projects that are not challenging them enough, they're going to feel stuck and frustrated.
Mm-hmm.
On the flip side, if they're repeatedly getting, or even just once getting a project that is too challenging, pushes them too far out of their comfort zone, especially with not the right levels of support,
Yeah.
that can lead to frustration, but also quality and timeline risks. So getting that balance is really critical. If we go to the next slide, we could talk about some potential solutions for this. So one solution, it really rests with the manager, right? Managers need to know the skills of their people. They need to know who on their teams can do what comfortably,
Yeah.
who on their teams can teach what comfortably, and who on their teams quite can't do something yet and need some support. So I'm curious, Matt and Julia, do you guys find this as well? Do you have strategies, like for example, maybe using a skill set grid to make sure managers track their people's skills and use those to make proper resourcing decisions?
Yeah, that's a great question, and I love that you brought up the skill grid, because I developed an experience grid years ago when I was at Takeda, and I asked for uh, when I would solicit candidates from CROs, I would pass the grid to them, and it looked at 4 quadrants, and one of those quadrants were how many of these particular documents, and I would list about 15 or 20 different types of documents, were you the primary writer on, versus
Mm-hmm.
how many did you support, and
Mm-hmm.
what period was this? How many years did you do this in? So we had these 4 quadrants where we could match people up with and determine how experienced they were on a particular document to a very finite degree, and it worked great for it. And I know that some of my CROs stole that. I gave it to them, and they used it, and they just started offering it to clients and sent it in with candidates when they went forward. I'd never seen it before, and my team worked on putting it together because we were getting swamped with applications, and we couldn't tell what they were good at.
Yeah, absolutely. Matt, I do swear that you and I are twins, identical twins separated at birth, because every time you talk about these things, I'm like, yes, that's exactly what we do. Well, we have exactly the same grid that we use for people coming in. The other thing that we do, Kim, in this vein is particularly for our associates as they're working on new projects, or even seniors who are doing a document for the first time, we have a peer review process. And out of that, the peer reviewer who worked with them or the lead writer who worked with them there's a feedback form that they fill out, and they can highlight, what are the things they're acing, what are the things they maybe still need coaching on, and that feeds directly back into their career development path so that they know, oh, okay, I could use some training on this. And it's really intended to make sure we're recognizing where people are strong and where people still need some guidance.
Yeah,
I haven't. Go ahead, Julia.
no, go ahead, Matt. You go.
No, I was going to say I have an interesting anecdote about how the demands on sorting out these skills, because at AbbVie back in 2017, I was hired to build out a specific medical writing group in the regulatory space. The submission space managed, the clinical operations group managed the writers that handled submission work, CSRs and dossiers and IBs and INDs and things like that. But it excluded the ability to support the regulatory group with briefing books for scientific advice and responses to agency questions. And they could only provide partial support. And it was really frustrating to the regulatory authorities. So our group decided to get permission to build out a medical writing group that specialized in these types of documents. So we had to start searching industry for these traits. And back in 2017, the ability to write a request for information document or a briefing book was not high on the CVs of a lot of writers. It might show up at the very last line of a skill set. And we were looking for those people. They became our unicorns, that we were looking for those people with that skill set. And over time, the industry caught up with us, and you'll see commonly now that CVs will list briefing books and requests for information often appear as the second, third, or fourth entry on a CV, because sponsors have realized the value of having this specialized skill set. So looking for these people was challenging originally, and now it's become the industry has met the need. It's an interesting demand kind of paradigm.
Mm-hmm. Yeah, some really interesting points there. And so I mean, it sounds like there's a tracking about numbers of documents, and I kind of think that kind of leads to our next point, which is ensuring. I'll get us there. It's not a direct lead, but I'll get us there. Ensuring that career paths are not too restrictive. So, and what I'm trying to say is like, make sure your job descriptions don't have requirements for certain types or certain numbers of documents. For example, if to go from a principal medical writer to a managing medical writer or whatever you're calling them at your organization, you might have a requirement to you must have led 3 dossiers, right? And what if their dossiers aren't as common at some companies, and so what if after 3 or 4 years there haven't been 3 dossiers or not enough dossiers to go around to the full team of writers that you have. So that can really cause promotion bottlenecks or progression bottlenecks. And so instead of focusing on 3 dossiers, like what are the competencies you're really looking for? Do you want to see that team members can lead a multi-document, multi-writer project? If so, maybe say that. Are you also looking to see that your writers can help a team, help guide a team through the strategy for a complex deliverable? If so, say that. There are other ways to do that than leading a dossier. So really focusing in on competencies. Yeah, go ahead, Julia.
I'm gonna play devil's advocate on that one. I totally agree with you. You can't just say, whatever, 5 CSRs, because if 5 CSRs don't come through the door, a lot of people will be left hanging.
Right.
But I wonder, at the same time, it's very easy to say, well, you have to be able to lead a strategic multi-document project. But how do you demonstrate that without having done a certain number of them and having done them successfully and gotten good feedback on it, right? So I wonder if you still don't maybe need a couple of numbers in there, maybe not down to a specific document type,
right?
But in the breadth, like having led at least 3 multi-document complex projects or something, and they can be whatever. But because in our experience, what we find is that, like I always say, the first time you write a CSR, you're getting the lay of the land. The second time you write a CSR, you're starting to get a feel of how it works. The third and fourth time, you're really getting, you can do that, right? You're really getting to know it, and you've seen different ways that it happens and stuff like that. And so the number of times you do something, the number of iterations, does also imply a certain amount of experience that you've gained.
Yeah, I totally agree. I think I'm less opposed to the numbers than I am to the specificity, like it has to be a dossier. So yeah, I definitely agree with you, Julia. And Matt, sorry, I think I cut you off. What were you going to say?
That's okay. No, a couple of things, a lot to unpack there, but I'll try and keep it short. Number one, we would use a technique where we would either have a lot of people call it shadowing or ghosting. We would have an experienced writer on a project and allow a newer writer to work alongside them to see how it's done, and then switch their roles, have the junior writer work on something more hands-on, and have the senior mentor be over their shoulder until eventually they can release that person into the wild and they're a successful writer. And I couldn't agree more, Julia, on the skills. The CSR is a great example, because after a while, especially when I was on my own, I wrote so many CSRs that if somebody said, "Can you write this CSR?" and I said, "Sure, give me a protocol, a stats plan, and a protocol stats plan." There was a third piece. Oh, and the tables, listings, and graphs, and I'll have you a draft in 3 weeks, okay? And off to the races. And we would typically get them done. And back in those days, in the late 90s, early 2000s, we would have a CSR draft, a solid draft, approvable draft done in 5 to 6 weeks. And that it's not common anymore. And I think they're trying to get back there with AI. But you use these mentoring skills, but it's also incumbent upon the leadership to really be paying attention to what's happening underneath them. You have to be intentional about your development plan and make sure your newer writers or your or people that you're bringing in from outside are gaining the experience in the systems that you use, in the styles, the templates, and the institutional knowledge that they need to have to succeed. And that's a managerial or leadership requirement, in my opinion. So
I really agree with you.
I hope that's helpful.
Yeah, yeah. I feel like we could talk about that bullet point forever. But let me move us along to the next, proposed solution in, matching assignments with development needs. So one thing we have tried and kind of played around with are rotations. So rotating writers through different specialty groups in our department. So we have different roles. We have writers who write different document types. We have different therapeutic areas. And so making sure we're using exposure to something different, whatever that something is, to help broaden writers' experience and skills. And we found this can be really helpful at multiple stages of development, right? We've had newer writers rotate through different specialty groups to get a flavor of, I'll give an example. So we have a specific group that writes informed consents. We have a specific group who writes or who does disclosure of like protocols and clinical study reports, like disclosing them on clinicaltrials.gov, for example, for the public. So when we hire in new regulatory writers, we want to give them a broad foundation. And so we don't just teach them regulatory writing, but we also give them a chance to rotate and spend a few months with our informed consent team to really gain an appreciation for health literacy concepts, for how a protocol is used downstream, like one of its purposes. And then we have them rotate through, spend a few months with our disclosure team. And again, like they get to see a lot of protocols and clinical study reports that way and understand how they're used. Again, one of the downstream purposes of those documents is to disclose to the public. And so by the time they, kind of pop out of this rotational program, they've had this really broad exposure and broad foundation to different types of writing that our department does, and then they're able to use that to inform their regulatory writing. So when they're writing a protocol for the first time, they have these ideas, these concepts in mind of how it's used downstream, which is really helpful from a content perspective, but also helpful from like a project management and understanding that if your CSR is not going to be ready on time, that could have implications for the public disclosure of it, right? So it gives them this much more holistic view of what we do. And from a resourcing perspective, it also makes them much more flexible. I think you're going to talk on the next slide a little bit, Julia, about hitting that like right level of work. And I think we can revisit this concept then to talk about how like this concept can help with that idea too.
Yeah.
And Julia, I apologize. I forgot that you were going to bring up the whole partnering with your mentors, and I stepped on that last bullet.
No.
I forgot all about that. So
great.
But I really love I do want to mention how much I really appreciate and I'm intrigued by the approach that you take of segmenting the roles or the tasks in order to almost have people do immersions or leap from task to task to task with these specialized groups to learn that skill set. I'm going to see about that on our side, that if somebody's willing to undertake that and give it a test, because we've got so many, the document catalog is so huge that nobody can learn all of the documents that they need to know to succeed across the spectrum.
I mean, something that's always been really important in our group is that writers are not siloed. And because of exactly what you said, Kim, right? The more document types you've seen, the better understanding you have of how these documents all relate to each other and downstream impacts. When you're writing the CSP, the protocol, if you know the pain points of writing a CSR when you've got a bad protocol, then you're thinking about that when you're writing the protocol. And the same thing from the report to the dossier. Anybody who's written a dossier and been given reports that don't have the information clear and everything, you're thinking about that when you're writing the report. And so we've always tried to make sure that our writers are touching different types of documents for exactly that reason. I think that's essential. Yeah. Absolutely.
Like that a lot.
Okay, I think that is actually a great segue into the next slide. which is another challenge that we want to throw out there. And that is, you've got all these writers, and we're trying to keep all of them as busy as possible. But how do we get them into the Goldilocks level of writing? Because they're not just writing. There's other things that they have to do around the live projects that they've got, right? There's non-billable activities. They have to do training. Sometimes they might go to a conference. There's process improvement initiatives. There's internal meetings. There's things that are going on that are not just about writing. And the other thing is when you're trying to balance the workload of your writers like those big, juicy, challenging projects, right? They're the fun ones. They're the interesting ones, which is great. It keeps them really busy, but it actually can keep them too busy. They can very quickly become overwhelming, particularly if you're like in the intense phase of a dossier where everything's landing at the same time. And you want to make sure that people don't have too many of those big, juicy projects happening in series, because otherwise they don't get downtime. So I think one of the challenges of resourcing is making sure that if somebody's had one or two really big, heavy projects, they get a chance to breathe by doing a simpler project for a while, right? So they get a bit of downtime. They get to go home and see their kids in the evening and play with their cats. The other thing is, I think that almost by their nature, right, medical writers are very detail-oriented, perfectionist types of people. They find it hard to stop and let go. You get down into the weeds of your document, and even once you've gone home to bed, you're laying in bed thinking about it, thinking about what you could be doing with different parts of it and who you should be talking to. And sometimes we need to step in and help them stop, right? Draw the line under the sand for them. And we had one writer who would not stop. And when she went on vacation, we actually took her laptop away from her. We didn't let her keep it while she was on vacation so that she would stop working. So, I think the question is always, how do you get that optimal amount? And I mean, one of the questions is, what is the optimal level? Everybody has these different KPIs they're working to. And what is it? Are we 80%? Is it 90%? Where's the optimal amount? And how do we assign just the right amount to make sure people are staying in and around that level? So if we go to the next slide, I think there's a couple of ideas we have as possible solutions. I think it's essential to have some kind of a software tool that allows you to actually see how much time has been assigned to the writers in your team, so that you can map out, in a dashboard, who's overloaded, who's waiting for work, who's sitting around with nothing to do, so that you can mix and match and make sure those things get shared. Of course, the challenge of that is keeping those things up to date. A tool like that is only as good as the information that's getting put into it. And as we all know, the one constant in our industry is the changing timelines, changing strategies, changing everything. So you're constantly having to keep these tools up to date. And I think what we do is we actually have a team whose job it is to be working with the writers and keeping our dashboards up to date in terms of the planned resourcing that's coming down the line. The other thing is, we try not to give people too many documents, right? Generally, I think we say about 4 to 5 documents in parallel. What is it on your teams? Like, where do you guys find is about the right amount?
Julia?
Kim?
Oh, Kim, sorry. Who said that?
We do around 3. Like, our ideas, one that's kind of starting up, one that's in full force, and one that's kind of ramping down. And that's assuming they're all kind of bigger documents, not necessarily dossiers, but like clinical study reports or protocols, kind of that scope.
That's a really good point, because I said 4 to 5, but for us that would be 4 to 5 of mixed complexity. That might include a couple of smaller ICFs that you're writing alongside your protocol, something like that. So absolutely, the complexity has to be a factor in that. Yeah.
Mm-hmm.
It's a great and a difficult question, especially in my prior model. The break that we used to have between the regulatory writing group and the clinical group, we've rejoined in the last 6 months, and we're teaching them our skill set. They're teaching us their skill set. And one of the tools that they brought over is knowledge notebooks, and it's a smart sheet type program where we can track utilization, and the sweet spot is to try and hit 1.0, which is one full-time person employed on that project for a specific period of time. If it gets into the 1.3, 1.4, and it goes into the orange or red, we know that they're being overloaded. If it goes into a lighter shade of gray, we know that they're underutilized. The curveball comes from the regulatory projects, as you both are very well aware, is the volume of unplanned projects that come from agencies because of these information requests. And if you have a large catalog, we've got 140 compounds and some over-the-counter products. And on active programs, we get bombarded by requests for information. We had our typical cycle with the FDA on a new submission was around 35 interactions with the agency to answer all of their information requests. On one of our most recent really large compounds that you'll see on late night advertisements over and over and over, had 75 discrete interactions with the agency, which was twice as much as we normally get because of the nature of the questions and the rapidity, because we had a voucher to expedite the review. So it was exceptional. And what we would find when we joined up with the other group is we kept telling them, we're highly unplanned. You have to keep space in your planner that's open. You need white space in your planner to make sure that you've got room to take on these projects. And it took them a long time to understand that, because we would start off and somebody who had like a 0.5, they showed up as underutilized at the beginning of the month. And lo and behold, by the end of the month, they were at a 1.2 or a 1.3 because unplanned work always kept coming. Yeah. So that's the tool that we used, and we've gotten to the place where we put in placeholders when we know there's going to be a potential for an unplanned request.
Yeah. Okay. And then one of the last things that I'm going to talk about on this one is I think it's more probably of a service provider issue, but for us, we're working with multiple different clients, and some clients are a lot more time intensive in the work that's needed just to maintain, like ongoing training from the client itself that we have to do. You might have a separate laptop, and things like that can very quickly become a burden for the medical writers. If you have 5 different laptops that you have to be monitoring daily, where you only have your inboxes on the laptops, it's challenging for the writers. And so that's another thing that we really try and balance. So there's no more than 3 different clients of the high intensity type, the time intensive type clients.
Yeah, and from the sponsor's perspective, and I deal with this all the time, I have 7 preferred providers and a host of independents and additional people in a waiting list that we pull from when we find like a preferred vendor has a logjam and they can't resource a need. And this happens to us where my group typically used 3 of the providers. They ran out of capacity. We would go to our backups and have to pull in these people. So from a sponsor's perspective, if you're a provider and you keep running into these log jams, our attention is going to wander, and we're going to move to a potential, who's the prettiest girl at the dance now kind of approach to make sure our needs are met. Unfortunately, it's kind of mercenary to say, but it's an unfortunate fact of life. So
no, but that's why this is so important, right? You need to have a system in place that allows you to not only resource effectively, but also resource quickly, right? You need to be meeting those needs. Absolutely.
And one of the things that we've done too is we've gone to vendors that would cooperate with us, and we said, can we build out a small group in your team that we can consider your guerrillas, your warfare, your people that can jump in and jump out into a project when we throw it over the fence. And we'd get 2 to 3 writers that we would upskill in these specific compounds that we didn't place a demand on them, but if writer A was not available, we could go to writer B, we could go to writer C and toss it over and get it back. And we didn't have a long-term commitment. Many of these projects are 2 weeks to 2 months, and that's it. And that's worked out very well. We call it a rapid response team, and it's worked out very well for us.
Yeah.
I
Okay, I
want
think, oh,
to.
go ahead. Sorry, go ahead.
Is there time? I promised to circle back to the cross training. So I just wanted to, or rotations, and I just wanted to kind of close the loop on that and say that I think, Julia, you'd mentioned, 4 to 5 documents at a time, but some of those are smaller. And I think in like if your organization has a model where like the smaller documents are written by specialty groups, then helping cross train everyone can really help fill in those gaps. If
Mhm.
a CSR is delayed by like 3 or 4 weeks, but you don't want to assign the writer another big thing because that CSR is coming in 3 to 4 weeks and they have some other stuff on their plate too, then, some of the knowing how to help write informed consents, or knowing how to disclose,
Mhm.
protocols and into the public
Mhm.
domain, knowing how to do some of these other more like they're not bite sized because that really oversimplifies what they are, but these kind of
Yeah, yeah.
smaller scope activities can really help. And then also having people who do those smaller scope activities cross-trained on how to do some of the bigger things would help. Matt, when you were talking about those unexpected requests coming in, if you have people who can come in and help with that because they're kind of cross-trained, can really help flex the resourcing pools.
Yeah,
Fantastic.
yeah, totally agree. I think that takes us nicely to the next challenge. I'll throw it over to you, Matt. We can go to the next slide.
Sure. So as far as the proposed solutions are resourcing challenges, I jumped ahead here. Hold on, where am I here? So my experience over the last 30 years has been that building a group dynamic that's dynamic and flexible is really challenging, obviously. As one large program dies, and all of a sudden you've got a bunch of writers that don't have anything to do.
Mm.
Um, and alternatively, and I speak from experience, it's not uncommon for a sponsor to find themselves with a favorability in their budget at the end of the year, and you all of a sudden have 3 or 4 large programs that are accelerated or green lit, and you don't have the writers to handle that demand. So the models that you have to use have to reflect that those demands.
Yes.
Um, so also, when you're looking at the challenges that the different companies face, a small biotech has a different set of demands than a medium pharma versus a large pharma, and one size doesn't cut it for all of them. The pipeline challenges, this sense of, are you very horizontal and spread out? When AbbVie acquired Allergan, we went from 45 projects to 195 projects overnight, and we went from three therapeutic areas into 15 therapeutic areas that were very, very large and very spread out.
Mm.
Kim and I have talked a couple of times in the background on these. Are you hiring generalists? Are you hiring enough generalists that can do what Kim is talking about, of jump, 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 and hit all these things? Or do you have the right mix of specialists who have that institutional and background knowledge that can really kill it for you on a clinical overview or a response for a specific document, a specific drug compound or mechanism of action? Those things have to be brought into the mix. The industry trends kill us, okay? There's this pendulum that's constantly swinging. Are you going to have an in-house resource because it's actually cheaper to have a lot of FTEs versus having an outsourced solution
Mm.
where you've got this flexibility to let people go when you don't need them, but their cost sometimes 60% more than your in-house resources. You get
Mhm.
the in-house resources and you find out they're very difficult to release when you have a downturn in industry or you lose compounds. And so the pendulum is constantly swinging in the industry. So what we just went through with COVID, where it was a desert for finding talent from the sponsor side. We were in so much competition with each other to find resources that we were hiring people that were right out of college and training them in-house to learn how to do this. And versus right now, which to me is a period of abundance for sponsors, there's a lot of talent that's available right now out in the industry. And my friends at CROs are struggling to place their people because the competition to place them is so fierce right now.
Mm. Mm.
So if you go to the next slide, I could talk about these models that you can consider when you're doing these things, unless somebody wanted to jump in on my thoughts there. I didn't want to cut you off.
No, I know. I think that's
Okay.
good to go to the next slide. Yeah, absolutely. The
Okay.
solution.
So over the last 30 years, building this dynamic and flexible group is very important. But the pipeline challenges, I've talked about this a little bit, this horizontal versus the vertical. the talent requirements, and Kim and I talked about the generalists versus specialists and the industry trends. Oh, okay. I'm sorry. I'm looking at the wrong slide. I'm sorry.
No worries.
Pardon me. Yeah.
Good.
So the models, okay, historically, three different models. There's the FTEs that people have always used, the full-time employees, the independents we've talked about, that I've got one that's followed me around for 15 years. I used her when I was at Takeda. She went to the next CRO with me, and she's back to me with AbbVie because she's just terrific. I don't want to let go of her. She's been with me all the way through. And then CROs, I have some of my best friends in industries are people that work that I've known for many years, going back to my time at Takeda, and they've become very close friends, which is probably kind of not a great business model to be, pals with your CROs like that. The variations that you can do to make these mixed models, FTEs supplemented by various CROs and independents and combinations, straight time and materials can be very popular for my rapid response teams. And then obviously the flexible service providers adds its own twist to that, where you have these resources that you're committed to paying for every month. And now that adds that complexity of, am I taking work away from an FTE to make sure I'm getting my money out of my money's worth out of the FSP, or am I short 5 hours and I've paid for 5 hours that's not utilized? So that adds another kind of twist. And that offers its own set of challenges. And then obviously the total outsource. And when we acquired Allergan, they had 9 full-time people in their medical writing department, and they had 145 products. They had a complete total outsourced solution. They literally threw their projects over a fence and waited for them to be thrown back. So right now, I call it, I've taken to calling it this hybrid solution, that where the small pharmas they have a limited FTE obligation because they don't know what the future holds. Sometimes the small biotechs are looking to be acquired. Sometimes they hit a home run and they need to bring staff in. So they use the limited obligation to FTEs and have a high contract utilization. Mixed media, a mixed pharma, a mix of FTEs with contract resources, ideal for bringing people on quickly and letting people go when you need to. And then large pharma is where I'm at right now, high FTE utilization, and fill in the gaps with the hybrid resources from the other two opportunities.
Yeah.
And the greatest opportunity I have is what you have to do with all of these models is inculcate institutional knowledge somehow, so you create value in these people that regardless of how much you're spending, you're getting your money's worth out of them.
And you know what? I just want to pick up on exactly that idea, because you said something right at the start of this slide where you said, oh, I don't know if it's a great idea to be like good friends with the CROs I'm working with. Actually, I'm going to pick up on that, because being on the other side, being the service provider side, I can tell you we have really strong relationships with many of our long-term clients. And it is important that those relationships are strong because it's a partnership. For exactly the reason you were just saying, our writers become completely embedded in the clients' teams, and it's seamless, right?
Mm-hmm.
They're not like an outsider. They're not somebody who is not part of the team. And if they are, I don't think they're going to function well. So it is important that you have a really strong relationship and a partnership between vendors and sponsors.
That's a fantastic point. I just want to add very quickly, and Kim, I apologize. That what you just said about embedding these people, we commonly have high-level people. I've had VP level people say, so-and-so is excellent. I'm going to give them an excellence award. And I said that they're a contractor. You can't give them a company award. But I found a solution that's to help with that, and so that they can do that. So, but they don't even know. They don't know.
It should be. That's the way it should be.
Kim.
Sorry, Kim.
Oh, it's okay. I just wanted to completely agree with that and know that I've seen it from both sides, right? As when I worked for a CRO, we had some sponsors who really embedded us and others where it was just very transactional and we were not embedded and we were an afterthought. And you can't succeed in that environment because, how am I supposed to know what key messages you want to get across when you won't even talk to me?
Exactly.
So, and then you done something and there's quality complaints and it's like, well, how was I supposed to know? And you didn't invite me to that meeting where you talked about it. So just wanted to agree with you wholeheartedly. I know we're short on time, so I will hand back to Julia.
No problem. You guys, I really just want to thank you for this conversation. It was so lively and so engaging, and I'm hoping that all of you in the audience have picked up a couple of valuable ideas, some tips for when you're dealing with these challenges in resourcing, how you can go about handling them, managing them. And yeah, thank you so much, Kim and Matt, for joining me today.
Thank you for having us.
It's been a pleasure. Thank you.
Thank you. Bye, Kim.